just another random update to show I'm alive. It is 11:30 on Tuesday, the 30th of May, so I'm about to go to bed, but I won't be able to sleep probably because I'm on chemo today. If I can show my chemo, but anyway, so I had chemo today for first time for a month. I usually have it every 2 weeks, but last time the oncologist said I should miss it to see if that helps my foot heal up. So I've got some big chunk of necrosis in my foot, which means part of my foot's died, and it can't really heal well because of chemotherapy, possibly. Last time I missed chemotherapy. I've been given a new medicine for trying to help the foot kind of regrow. There's like a big chunk of flesh missing, and a big chunk of dead flesh as well. That medicine is, I think it's called Prostadin or something. It's a Japanese medicine only in Japan. Doctors are very proud of it. I'm not sure how well it's going to work. It's meant to work in two ways. One is it's called vascularization or something, so it's like increasing blood flow to where the wound is. And another way it works is makes the platelets pile up more, or like more platelets at the wound site, or maybe makes them more sticky or something. I'm not convinced about that, because my understanding is that platelets are more involved early on when like a wound just kind of seals up, and are less important for like the actual regeneration of the tissue. That's my understanding based on something one of the doctors said. And in any case, my platelet counts have been kind of relatively normal during the chemo. So anyway, I had chemotherapy today without the molecular targeted therapy that I usually have with chemo. The molecular targeted therapy I have with chemo stops your body making new blood supplies, and it does seem to be very important in wound healing to get like new capillaries growing and stuff in there. So that's why I'm skipping this time. In 2 weeks' time, when I'm due to have chemo again, if my foot is not too painful, then I'm going to have the molecular targeted therapy as well. My oncologist is a very confident doctor, possibly overconfident, but he's relatively satisfied, it seems, with how the chemo is going. My immunotherapist, his attitude is basically, if you can possibly have chemotherapy, have it. I always say to him, I hate chemotherapy, I want to stop it. And he says, basically, if you can walk around and stuff, and if you could possibly have the chemo, have it. And when you get to the point where you can't have it anymore, then continue having it, but very low doses, kind of 5-10% of the recommended dose. Chemotherapy suppresses your immune system, but cancer suppresses your immune system as well. And it seems to be the belief of the immunotherapist that in many cases the cancer will actually do more damage to the immune system than the chemo will, which is kind of interesting. The immunotherapist, Dr. Teranoma, I think he knows his stuff. He's very, he's always telling me he doesn't know. He doesn't know. Nobody knows. Whenever I sort of ask him difficult questions, I mean, it occurs to me that maybe there are more people. That maybe there are some doctors in Japan who know more about cancer than him, but I would imagine he has treated more terminal patients, so patients who are going to die from the cancer. He's probably treated more terminal patients than any other oncologist in Japan, because just the number of patients. You go to the immunotherapy clinic when you've been told you're going to die from cancer and that the treatment is only going to sort of delay that a bit or not at all. So, at the clinic they have treated something like 10,000 patients over, well, maybe not at the clinic, but the clinic is part of a large hospital, for which Dr. Tedanim is an oncologist, possibly teaching staff as well. I haven't asked her about that, but I shall do. So my general policy is, talk to lots of experts, get their opinions, but basically go with what Dr. Tedanim says. So, today when I was talking to the oncologist about having chemotherapy, he said it was up to me. And Dr. Tedanim had said, try and have it this week if you can. So I said, yes, I would like it. It's weird because chemotherapy is horrible. From what I've read, I get off really, really fucking lightly with chemotherapy. It is for me, very unpleasant few days, but the side effects can be far, 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 far worse than I have. And the weird thing is, it's lovely going to hospital to have chemotherapy because the staff are just amazing. The chemotherapy nurses are just fantastic. Really, really great people to be around. Very, very caring and loving, etc., etc. But the thing that I like most is the incredible competence. It's just such a privilege to watch them work. Their physical dexterity is just outstanding. Their kind of robust adherence to the procedures with the double checking systems and that kind of thing. So it's kind of weird, like horrible having chemo, but lovely to be at the hospital. And while I was sat there having my drips over a period of 4 and a bit hours or whatever it was, I was reading a very interesting book called We Do Things Differently, which is, I think the author's name is Mark Stevenson, and it's the first book for the book group I've just started. Yes, I've got a book group. There are 7 members. There's room for 2 more. I've asked 3 more people who are kind of dithering, I guess, about whether they're going to join. And the idea is we'll read 1 non-fiction book a month, starting with quite light stuff. And quite rapidly getting onto some tougher books. And we meet and discuss the book, but also, if possible, I'd like all the members to produce notes, not about the book itself, so not kind of a summary, although for some of the more difficult books, I think most people are going to want to do a summary of it anyway, but instead, kind of notes related to the topics of the book. So if anything is particularly interesting in the book, kind of go out and get some more information about that, maybe some differing opinions, or if a book mentions a scientific paper, then go and read that paper and maybe summarize that, and then we'll give our notes to each other. So for every book we read in the book club, we'll end up with kind of a body of knowledge that goes with that as well. So really looking forward to that. Be interesting to see who makes it to the meetings and who gets the books read and stuff. A lot of the members are these kind of cool kids who read ebooks. So it's interesting. So we'll see. And so when I kind of got back from hospital today, I saw that Stuart Woodward incredibly raised a bunch of money for my cancer treatment at his birthday party, which was a couple of days ago. So kind of him to do that. It's quite a lot of money, which is good, because my treatment's expensive. But also any donation, makes a big difference, because it keeps the campaign alive. But also, Stuart's big donation just happened to come at the ideal time when I'm starting my intensive immunotherapy this week. That's costing a lot of money. I think the bill was something like £12,000. That's interesting and helpful and wonderful. So thank you so much, Stuart. What else? For about a month now, I've been taking a medicine called DiChloroAcetate. In my case, I think it's sodium dichloroacetate. This is an incredibly cheap chemical, but for some reason, the source that one of the doctors has is a very expensive source in America. So I'm paying a ridiculous amount of money for dirt cheap chemical. However, the cheap sources on the web, they're usually selling the kind of the industrial version of the chemical, which is not necessarily fit for humans to consume, because it might have a bunch of junk in it. I don't mean like it's kind of cut with anything, but could be contaminated, because when you produce industrial chemicals for laboratory experiments, you're not making something that's food grade. Hence, I'm spending a lot of money on this dichloroacetate, and it seems to be that the source in the US is basically a doctor who is doing a maybe out of desperation doing a kind of patient-funded clinical trial. Doctor in Japan says that he's not making any margin on it. There's no profit in it. He's selling on to patients at cost. So the reason I'm taking that. So dichloroacetate is one of these things that was kind of touted 7 or 8 years ago as this may be like a dirt cheap wonder drug to kill cancer. It seemed quite promising in preclinical trials, and then larger preclinical trials showed it wasn't as promising as they thought, and it wasn't necessarily as safe as they thought. There was a belief that the dichloroacetate would change the metabolism of the cancer cells, and this would be enough to make the cancer cells die, and that dichloroacetate was harmless to all other cells, but wider preclinical trials, laboratory testing, found that wasn't necessarily enough to kill cancer cells, and also was actually damaged some other non-cancer cells. So the reason I'm trying it is not to kind of kill the cancer cells directly, but because one of the ways in which cancer cells are protected from the immune system is that their metabolism makes a layer of acid, of lactic acid, around the tumours. It's called the part of the tumour microenvironment. And when the immune cells, kind of white blood cells, go to attack the cancer, they get killed by that acid, or a lot of them do. So fewer get through. And in preclinical trials, although the DiChloroAcetate didn't necessarily kill the cancer cells, it did stop this layer of acid, lactic acid forming around the tumours, and therefore the immune cells, like the NK cells, those are the natural killer cells, get through more, or a larger percentage of them get through into the tumour, and hopefully kill the tumour a bit more. The anecdotal evidence, at least the clinic where I'm at, seems pretty strong, getting quite good results. It would seem. Anecdotal evidence is not usually something you should pay attention to, but in this case, because the mechanism seems kind of grounded in reality, and there's quite a lot of preclinical evidence that the mechanism exists. That's why I'm trying it. So that's good. Other than that, nothing amazing to report. I shall do more videos soon. You will notice I'm not rushing at the end anymore, because I finally gave in and gave my cell phone number to Google in exchange for them removing the 15-minute time limit on my YouTube videos. So yeah, no gabbled rush at the end, which is nice. Thank you for listening. As always, please share these videos. Really makes a big difference. And please comment any questions. Wonderful. If you're going to ask any question about me, about cancer, about any random stuff, I'm always very, very happy to answer the questions. Questions like, have you eaten mistletoe today, are not so good, but yeah, ask those if you like to. Okay, thanks a lot. And my cancer fundraising website is at www.matthewdons.org. It's MATTHEWDONS.org. Thanks a lot. Bye.